have several of our colleagues here this afternoon sitting in the front: Mike Turner, Rafael Ruiz de Castaneda, Bethany Moos, and Anna Pinter, who's in Cairns, who's going to join us. So to set the scene, I just want to give you a little bit of an introduction as to where we're at with WHO's roadmap. Of course, as you all will probably remember, this roadmap has 4 key pillars: engaging and empowering communities, and Beth is going to talk about some of that work this afternoon, about improving participation, developing and implementing sustainable solutions that reduce the burden and improve the outcomes for those who are affected, both in terms of prevention, control, better health-seeking behaviours and so on. WHO's got a very important focus on ensuring safe, effective treatment. I'll touch on that a little bit further before the end of this meeting. It involves not just improved quality surveillance, product evaluation and regulation of things like conventional plasma-derived antivenoms, but also helping to establish pathways for the development of new treatments for snakebite. Our work on strengthening health systems, which I'll also touch on. We're working with countries to support operational change and systems-wide improvements. And then in the last of the pillar areas of partnership, coordination and research and resourcing, it's all about trying to build strong, collaborative, well-resourced and outcomes-driven coalitions of partners. So to crack on with this, the first thing I said, Beth is going to address this a little bit more, is our need to engage and empower communities to do what they can for themselves to deal with the problem of snakebite. Particularly from a prevention perspective, avoiding bites is always going to be a better outcome than being bitten in the first place. We have, over the last 12 months, focused very heavily on listening to community engagement activists, researchers and other stakeholders, trying to understand the current landscape, who all the players are in different countries around the world, what the sorts of obstacles and challenges that they're facing that need to overcome, and how potentially WHO can help them to solve some of those particular issues. In parallel, we have conducted and published a scoping analysis of community engagement activities across quite a wide range of other public health issues. Basically, what we wanted to do was see what everybody else has been doing, get an idea for what works, what doesn't work, so that we're not necessarily reinventing the wheel or using a particular approach that's already been shown to be ineffective. And that's giving us a lot of insight into the sorts of things that will work, so that we can design and develop effective programs that are properly structured, implemented and are sustainable. And the major output that we have in mind is a snakebite community education toolkit that will help all of these local stakeholders with their engagement with communities, but also with just some of the challenges that they face in getting things done. One of the early discussion groups that we had, it was very obvious that just in terms of things like, how do you prepare a budget for a particular project? How do you get approvals from government? How do you actually interface and engage with government as a civil society organisation? Are very important issues to them. So things around the practical ways in which they do their work are very important to them as well. So that's what we've tried to do. Rather than lecturing to people, we're trying to do as much listening as possible and then trying to develop solutions that will help them. In terms of safe and effective treatment, we have a multi-pronged approach that's aimed at improving antivenom quality, safety, effectiveness, but also ultimately affordability and accessibility, particularly in low-income countries. Mike Turner is going to talk to you this afternoon about our development of target product profiles. This is essential guidance for manufacturers and regulators on minimal and optimal design and formulation features of different treatments for snake bites. And like I said, we're not just talking about conventional antivenoms, we're talking about things like small molecule inhibitors, next generation antibody products that have been engineered and so forth. A big piece of the work that we're doing revolves around the development of an antivenom stockpile pilot program. It's basically about developing the capacity to support the supply, distribution and surveillance of quality assured antivenoms, with an initial focus in sub-Saharan Africa. We have an interest in improving standards and protocols, not just in terms of some work we're doing at the moment, starting to come up with a methodology for venom and antivenom reference standard development, but also updating our technical guidelines on antivenom production, regulation and control, developing materials for health worker training, and consensus clinical trial methodologies. So all of the sorts of things that can support improving the state of treatment. And then last of all, we have a risk-benefit assessment approach, which is a precursor to eventual pre-qualification of antivenoms. We're evaluating current antivenom products to determine their suitability for procurement and clinical use. Basically, as a precursor to that, like I said, it's quite a challenge coming up with a way to pre-qualify antivenoms that is not going to drive public manufacturers out of the market, but is actually going to help and support them to improve where they need to improve, and ultimately to get better quality products across the board in all areas. But our antivenom stockpile pilot program is fairly ambitious. We're coming to the end of phase 1 at the moment, and it's a whole package of different pieces of work wrapped up into one. Everything from basic landscape analysis and stakeholder consultation in the countries where we intend to initially deploy products. We have a large piece of work we're doing with WHO's geospatial experts in the data and analytics department around geospatial model development and testing. Raphael's going to talk a little bit more about some of that work this afternoon. And I think he'll also talk a little bit about the snakebite information and data platform, which is part of the way we want to be able to make sure that data is shared and accessible. We have some big pieces of work that are being done on cost effectiveness analysis of antivenoms and cost benefit analyses of country level distribution, looking at different alternatives to distributing antivenoms to see what is the best way to do it in a cost effective manner in different countries, different topographies and settings. And then the development of health worker resource needs and training tools. Phase 2, which we hope to get off the ground in the next 2 years, will actually see a final plan for that developed. It'll see us nail down a surveillance and data collection system, a stockpile finance facility, bring on board member states and stakeholders, and then roll out a pilot stockpile in 8 countries with comprehensive MRE program to support that. So the monitoring, the reporting, the evaluation to see how well it works. And it could go on from there. Potentially it could go to a phase 3, which would see it expanded right across sub-Saharan Africa, and even potentially handed over to external project management once we know that it's able to stand on its own 2 legs. And in the longer term than that, potentially adapting it to other regions of the world that have similar problems, introducing additional types of commodities as we see things, for example, like small molecule inhibitors or next generation products. If they actually get to market, then it may well be that this is an avenue through which they can be made much more accessible. In tandem with all of this work, like I said, Mike's going to talk about the target product profiles, our risk benefit assessments I'll touch on in just a sec, but we're also doing a lot of work to improve snakebite epidemiological reporting at health facility and community level, and improving the various types of technical advice that's available to producers, regulators and procurement agencies. So the risk benefit assessment, we started in sub-Saharan Africa initially with 9 applications, 2 that couldn't be considered because they were actually products for other regions, 2 assessments that were terminated, although one of those manufacturers has recently reapplied for assessment, and we've got their product samples and dossier just in the last week to start looking at that product again. There are 2 other products that are non-GMP compliant, and in the next few months, if we can't get them to commit to a timeline for that, it may be that those have to be terminated as well. And then there are 2 products that have been recommended, and another recommendation is pending approval this week. But this year we started 2 new assessment rounds, one in South Asia for the classic big 4 venomous species from Pakistan to Bangladesh and Sri Lanka. One is a polyvalent product that also includes hifnali in the immunising mixture, quite interestingly. But we got 8 applications from that region, which is really very encouraging, and included all of the major manufacturers. In the Middle East and North African region, we also got 9 applications for products marketed from Morocco all the way across to Afghanistan. 6 of those are polyvalent, 3 are monovalent, and our timeline is that we expect to make final decisions on all of those applications by early next year. Now, this is a fairly comprehensive process. Basically, it involves a very comprehensive dossier review by independent experts. They evaluate the information, they look for deficiencies, they raise questions that we clarify with the manufacturers, and then make preliminary recommendations on the risk-benefit relationships. We do a very comprehensive laboratory assessment with a minimum of 2 batches of product, looking at everything from their physicochemical properties, their mass spec profiles to see what is potentially in them that shouldn't be, and then an extensive in vitro and in vivo preclinical potency and specific toxin neutralizing test panel that we go through. It's capped off by GMP inspections. WHO inspectors visit all the manufacturing sites, and we don't just look at the production laboratories, we look at where the snake venoms are being produced. We look at where the hyperimmune plasma production is taking place. We even look at the small animal use. So we look at all of the steps in the process. And at the end of that, if they get an overall positive risk-benefit ratio, they may be recommended for procurement for particular use cases. So, for example, a polyvalent antivenom for Africa, we found that we could only make a recommendation for its use in viper bites because it just wasn't adequately potent to recommend for any of the elapids. But the manufacturers get very comprehensive reports that enable them to delve in and find out what they need to improve. And it's really meant to be an iterative process in that sense to try and help them to develop further. Recently, we launched a website where you can find information on the assessment process. The URL's at the bottom of this page. And for the new assessments that we're doing, we altered the terms of agreements. We'll actually be able to publish transparently the GMP reports and the laboratory reports. So we'll be able to provide a lot more transparent information to people who are using this resource. But from the perspective changing pace to strengthening health systems, the big thing that WHO has been engaged in is high level and technical level group engagement with ministries of health in affected countries, particularly focusing in sub-Saharan Africa from our side, but our colleagues who work in the Southeast Asian region have actually been very proactive. They are presenting a strategic plan for Southeast Asia to all of the health ministers in that region next month, and hopefully it will lead to a lot more investment in dealing with the problems of snakebite in the Southeast Asian region. And it really is our goal to get greater regional cooperation and country level integration. Some countries, for example, Uganda, are in the process of developing their own strategy at the moment that they want to roll out. And the more of that we see where snakebite becomes part and parcel of national health plans, where there's proper investment in things like procurement, resourcing for health worker training, for the various different medical services that are required to get better outcomes for patient, the better off people will be. We have, and I think Raphael is probably going to talk about work we've been doing with Access Mod, looking at analysis of distance to healthcare referral pathways and also drug supply network efficiency to be able to streamline some of these steps that governments need to take to make sure that proper treatments are available right where people need them the most. And Bethany will also talk a little bit about a minimum specifications for health facilities package that we've been working on over the last 6 months. Next month, we're going to add some new features to the data platform we launched last year, including maps that will show some of the epidemiological data that countries have been contributing. We don't have coverage from every country yet, but we've been very encouraged by the number of countries, particularly in sub-Saharan Africa, who've been contributing data in the pilot phase of this. And again, there's a URL that you'll be able to follow to get to that site once it launches. But then lastly, like I said, the biggest challenge we face is one of building strong partnerships of proper coordination so that we're not stepping on each other's toes, or you don't have multiple groups doing exactly the same thing and wasting resources. And then trying to get more people from a wider pool of potential resource providers interested in this subject. Our focus has been working with the regions and the countries to support their efforts. We're continuing to map stakeholders and build up a database of organisations, everyone from people involved in community engagement to laboratory-based research that are around the world that are working on snakebite, so that we can actually map the landscape. And again, one of the things we're going to tackle next is the various avenues for collaborative funding of this 8-nation pilot program for Central West Africa that we want to embark upon, both for the operational research costs and the commodities themselves to kickstart the stockpile off. Our data sharing capabilities that are improving all the time with the development of the information and data platform. I think Raphael might cover that a little bit, but eventually through the Creative Commons arrangements, all of the data sets that we're going to put online will be available for researchers to access and make use of, whether it's the access mod tools or whether it's the epidemiological data or whatever it happens to be. And that's the direction that we hope to continue moving to in the next year or so. So I'll end there. Our team in the NTD departments, led by Bernadetta Bella-Ritter, who most of you will know. Raphael, Mike and Bethany are in the front row. You'll be hearing from all of those. In our health policy and standards, we have Yuyung Mariungasing from Indonesia. She works on some of the blood products, including antivenoms, and coordinates the expert committee on biological standardisation. And then I work in regulation and pre-qualification with Carmen Rodriguez Hernandez. And we're basically responsible for the risk-benefit assessments of antivenom products. WHO's work very generously has been funded by the Lillian Lincoln Foundation in the past and currently by the Wellcome Trust. And we really appreciate their help and ongoing support. So thank you very much.